So this is what I mean when I say that the 12-month wait rule really does couples a huge disservice. But for both male and female factor fertility, but especially for male factor fertility, because there's so much we can do to improve sperm numbers. And if we know what we're dealing with sooner rather than later, we can really tailor your approach for you specifically. So if you have some of this information already, and maybe you're not ready to join Fertility Confidence Method and come in and get like a full supportive plan. We do daily office hours. We have an amazing community. It's a great place to hang out, but maybe you just want some male fertility support. We actually do have an offshoot program called His Confidence, and it goes through all the testing that's in Fertility Labs 101. So all that's included for the male side and His Confidence. But then what do we do about it? Right? We talk about nutrition and lifestyle, basic risk factors. How do we make those changes? And we also talk about supplementation. And I share the research around different supplements based on what we have and what we see in a semen analysis. So those links will be down below for you. We do all this process inside FCM. Obviously, we're the ones putting the plan together for you for both partners, for both female and male partners. Inside FCM. But if you're looking for just the male support, His Confidence is a really great place to get that. And I think that the first thing you need to do is, if you haven't had testing, even if you're under the 1 year mark, is to really strongly advocate for it or seek it out. If your doctor's not willing to do it, find a doctor who is. And I think this is like a big, people are like, oh, but you can, you're allowed to shop around. You're allowed to look around for different options. There are different types of doctors. Like I said, I can order semen analysis here in Ontario. Functional medicine doctors can order semen analysis, find a naturopathic doctor. Like, there are a lot of options. You're not pigeonholed into this concept of the conveyor belt system in mainstream medicine. We want to maybe get on the conveyor belt, right? We want to maybe continue through that process. Absolutely. Because eventually we might need the fertility clinic. We might need some of the things that they offer us. It's not one or the other. It needs to be a synergistic combination of both. And the beautiful thing about, what I do and why we have the podcast and YouTube and Instagram is because I really do think there's still a lot of people out there that don't know that they can seek these things out, that they don't have to wait, that there's lots of things you can be doing to improve and support your body on the fertility process. And so I'm going to continue to just spew that out into the world, because even if it just helps 5 people make different decisions and earlier decisions and potentially shorten their fertility journey, I've done my job. And this is a big, big factor in terms of shortening your fertility journey, because so often the men are just forgotten about it for a wide variety of reasons. We actually talked about this from a mental health perspective in the previous episode. If you haven't listened to that, and especially shared that with your partner, I highly, highly recommend it. I think it was a great episode with John. And we talked about how in the fertility clinic space, in the fertility journey, that men just often get left behind, and not just about testing and treatment, but in a whole variety of ways. You need to be an active participant in your fertility journey. And that might mean that you need to stand up for yourself and advocate for quote unquote earlier testing. I don't believe it's early. I don't think there's ever a time that's too early to get testing. And there's never a time that's too early to get support. We have couples come and join us in FCM who've only been trying for 2 or 3 months, but they want to be proactive and they don't want it to take 2 years. So they're going to make those decisions earlier. They're not going to just linger and fester and continue doing the same things that aren't working. And this is where, getting support, I think, is so important when you are ready, right? When you are ready. Maybe you're not there yet. That's totally fine.